I'll just ask you, what's the most embarrassing thing that owners usually ask you about?
I think for me, a recent one that I continually get has to do with like pets who are scooting, or maybe pets who have been like kind of smelling around the house, or like when they sit down, people notice a little smell and they're like, I'm not sure if this is normal for my dog or not.
Mhm.
And I feel like pretty commonly people come here and they may have like tendencies not want to, like, kind of they dance around the topics. And I will be the first to say, I feel like those are topics that we talk about regularly. And if I don't talk about them in a wellness appointment, I feel like sometimes I'm not doing my job all the way, just because oftentimes it has something to do with the anal glands. And so once we get those expressed or kind of address the underlying issue as to why they're not expressing normally, we can get these patients cleared up, and oftentimes they don't come back for the same ailment. Though I will tell you, we have repeat offenders who come in every other to like every third month or so to get their anal glands expressed. And sometimes that's just kind of the nature of these kiddos. What about
Yeah.
you, Amy? What do you
Yeah.
got?
Well, some people don't even know that dogs and cats have anal glands. So that's just another thing that we wanted to kind of mention. Dogs have anal glands. And usually they are expressed normally with like normal bowel movements and defecation. But, like Dr. Riva said, some dogs have issues and people are kind of surprised by that. So, but some of the things that I get, the questions that I get that are just kind of awkward are, my dog's penis is just out sometimes, and that's kind of weird. And so it's definitely something that is normal. Sometimes when dogs get excited or they're just really energetic, really happy, the penis can extrude from the what's called the prepuce, or just the skin covering the penis. And so that's normal. Sometimes it can be like a sexual behavior too, like if a dog is just aroused. So that is normal. What are your thoughts on that?
I would say that that also extends beyond just dogs to cats, even where sometimes we may have some of our kitty patients that will have a tendency to, even after neuter or spay, mount, whether it's like, people or stuffed animals or whatever it is. And I mean, though these can be symptoms of kind of retained, like, for lack of better words, intact nature, for lack of better words. I think that we can kind of address these concerns. Number one, as they are normal in a sense that some pets may have increased tendencies to just be excitable, whereas sometimes these can be symptoms of an incomplete spay or neuter. And so we may want to address that and maybe do a hormone testing or figure out maybe what's going on, or maybe we can address this with behavior modifications. But this is not like a behavior that we have to just sit there and tolerate. There are some things that we can do to kind of maybe redirect the attention to a more productive outlet.
Yeah. And it is abnormal if the penis kind of stays out of the skin. That is abnormal. So that should be definitely looked at by a veterinarian.
There, another commonly observed thing, or I guess not super common, but we do see relatively often, is pets that come in after having ingested recreational drugs, whether that is something along the lines of marijuana or other things, whether that are in like normal households. And so, what I will say is, number one, the veterinarian's on your side. We are not here to report anyone. Oftentimes, these are like accidents, and so we are totally understanding of that, and we're not here to kind of report anything to the police. More so, we're trying to make sure we're able to address what kind of concerns are going on with your pet at this current moment. Even if it's a potential exposure, it's totally fine, so we can know how to best treat your patient. Sometimes these are very non-specific in their presentations, and so we may not know the best course of action until we're able to get more of a definitive nature as to what's going on. And even if that involves drugs, it's something that we do see with a decent amount of frequency, and we are able to address once we have more understanding of the underlying nature of what's going on.
So we're not going to be calling the cops or anything. If you tell us that your cat or your dog got into drugs, don't worry about that. We really just want to, like Dr. Rivas said, treat your pet appropriately. So just be open with us, be honest if you can. I know it's awkward. It's an awkward topic to talk about, especially in a state where recreational drugs like that are not legal. But again, it's important to just let us know, be open with us about it.
And then that kind of leads to the next is just like in general, as your veterinarian, we deal with awkward topics pretty regularly, whether that's like Dr. Bonnet was talking about with regard to like concerns associated with urogenital problems, or maybe concerns with, like we're talking about now, drugs or other things that arise, whether that's problems associated with the rear end or maybe with the teats. There's no topic that we haven't talked about before, whether it's with a client now or in the past. And so we're more than open ears as far as if you have questions or concerns to talk about these topics. We want to be that resource for you as opposed to maybe just looking on Google, where we can actually give you reputable information to kind of reference or to maybe know what some appropriate next steps or levels of concern should be.
Yeah, so feel free to ask us the weird questions. We can laugh about it. We can laugh through it. It's not awkward. It can be awkward, but we're here for that. So we can help out. Just ask us the questions. Go for it.